Did you know that in the United States, someone dies of cardiovascular disease every 34 seconds? Nearly 2,500 people in the United States die from cardiovascular disease every day. That's a staggering number, underscoring the importance of understanding the risks and warning signs. Heart disease isn't something that happens to other people. It can affect anyone, regardless of age, gender, or background. We often picture someone older with chest pain, but the truth is that heart disease can develop much earlier in life, sometimes even in young adults, due to lifestyle factors like diet, exercise, and stress. It's not just a men's issue either. Women are just as at risk too. Heart disease remains a leading cause of death worldwide, and a significant challenge is the fact that many people don't recognize the subtle cues their bodies provide. We often dismiss symptoms as stress, fatigue, or just getting older, leading to dangerous delays in diagnosis and treatment. This misconception can have devastating consequences. One of the biggest problems is that heart disease can be a silent killer, often showing no apparent symptoms until it's too late. That's why being proactive is so important. It's not enough to think about your heart health occasionally. It must be a consistent priority. We often underestimate the severity of heart disease and fall prey to misconceptions. We might think it's purely genetic, but while family history plays a role, our lifestyle choices are a huge factor. We have more control than we realize. So, what can we do? First, we need to educate ourselves. Understanding the warning signs is the first line of defense. We'll talk more about those in a moment. Second, we need to take action. This means making healthy, daily choices. We will share all these with you in this video. Think of your heart as a garden. If you neglect it, weeds will take over and won't flourish. But if you tend to it, nourishing it with healthy choices and giving it the care it needs, it will thrive. It's not about making drastic changes overnight. It's about making small, sustainable choices that add up over time. It's about taking control of our health and empowering ourselves to live long, healthy lives. Because a healthy heart isn't just about us. It's about the people we love and the lives we want to live. It's about having the energy to play with our kids, the strength to pursue our passions, and the peace of mind knowing we're doing everything possible to protect our well-being. So let's equip ourselves with the knowledge to understand our hearts better. But before we start, we would love to know where you are watching from. Tell us in the comment. You will have to watch this video to find out the number 10 sign and be amazed by it. Here are 12 critical signs of heart damage you should never ignore. Chest discomfort related to heart issues isn't always the dramatic, clutching your chest pain you see in movies. It can take on many different forms, and this is why it's so important to be aware of the subtle variations. We have 7 variations of chest discomfort in this video. A. Pressure or tightness. Imagine a heavy weight sitting on your chest or a band tightening around it. It's a constricting, squeezing sensation like your chest is being compressed. This is a standard description of angina chest pain caused by reduced blood flow to the heart muscle. B. Aching or dull pain. Sometimes the discomfort isn't sharp. It might be a dull ache, a persistent soreness, or a feeling of heaviness in the chest. This can be easily mistaken for muscle strain or other less serious issues. C. Burning sensation. Chest discomfort can also manifest as a burning feeling similar to heartburn or indigestion. This can be particularly tricky, as many people will reach for an antacid and ignore the potential underlying heart problem. If you experience a burning sensation in your chest, especially if other symptoms accompany it, don't assume it's just heartburn. D. Sharp pain. While less common than pressure or tightness, a sharp pain in the chest can also be a sign of a heart issue. However, it's important to note that not all sharp chest pain is heart-related. Many other conditions can cause sharp chest pain, such as pleurisy, inflammation of the lining of the lungs, or musculoskeletal problems. The key is to pay attention to any new or unusual chest pain regardless of its nature, and seek medical attention if it's persistent or accompanied by other symptoms. E. Location. While the center of the chest is the most common location for heart-related discomfort, it can also radiate to other areas, including the arms, especially the left arm, shoulders, back, neck, jaw, or even the upper abdomen. Think of it as the pain spreading from your chest to these other areas. F. Triggered by exertion. Angina, chest pain due to reduced blood flow, is often triggered by physical activity. The heart muscle needs more blood when you're exerting yourself, and if there's a blockage in the arteries, you might experience discomfort. The pain usually subsides with rest. G. Come and go pain. Chest discomfort from heart problems can be intermittent, coming and going. Don't be fooled by this. Just because the pain subsides doesn't mean the underlying problem has gone away. Any recurring chest discomfort warrants medical evaluation. Number 2. Breathlessness or dyspnea. This isn't just the expected shortness of breath after a strenuous workout. It's a different kind of breathlessness that can be much more concerning. Imagine feeling like you can't catch your breath even after doing very little, like walking to the kitchen or climbing a few stairs. It might feel like you're constantly gasping for air, or your lungs aren't filling up. Don't brush it off as being out of shape, especially if it's a new symptom or worsening. Please pay attention to when it occurs. Is it during exertion, when you're resting or lying down? Breathlessness, which happens when you lie down and force yourself to sit up to breathe, is a particularly worrying sign. Some people describe it as a feeling of suffocation, a sense of not getting enough air. You might also notice your breathing becoming faster and more shallow than usual. Sometimes it's accompanied by wheezing or coughing, especially if fluid buildup in the lungs. The key takeaway here is that a medical professional should evaluate any new or unusual breathlessness, especially if it's persistent, progressive, or accompanied by other symptoms like chest discomfort. Don't hesitate. Your heart's health depends on it. Number 3. Fatigue. This is more than just feeling tired. We all experience tiredness. Life is busy and there are plenty of reasons to feel worn out occasionally. However, the fatigue associated with heart problems is different. It's not just about needing a good night's sleep, it's a more profound, pervasive exhaustion that interferes with your daily life. Think of it as a weariness that settles deep in your bones and doesn't lift, even after rest. Imagine feeling so drained that simple tasks, like getting dressed or making a meal, become Herculean efforts. It's not just feeling tired after a long day, it's feeling tired all the time, regardless of how much you've done. This kind of fatigue can be a red flag, especially if it's new, unexplained, or accompanied by other symptoms. It's crucial to distinguish it from normal tiredness. Ask yourself, is this fatigue significantly impacting my ability to do what I normally do? Is it different from how I usually feel tired? Does rest make a difference? If you answer yes to these questions, it's worth discussing with your doctor. They can help determine the cause and rule out any underlying heart issues. Remember, this isn't about feeling tired after a busy day. It's about a persistent, overwhelming exhaustion that disrupts your life. Number 4. Palpitations. This is when your heart skips a beat, or several. Palpitations are those sensations where you feel your heart beating in your chest, sometimes forcefully, rapidly, or irregularly. It can feel like your heart is fluttering, racing, pounding, or skipping beats. It's a strange and sometimes unsettling sensation, like your heart is dancing inside your chest. While occasional palpitations are often harmless, especially after consuming caffeine or experiencing stress, paying attention is essential. Think of it as your heart trying to get your attention. Ask yourself, how often do they occur? How long do they last? Are they accompanied by other symptoms like dizziness, chest pain, or shortness of breath? If you notice a significant increase in the frequency or duration of palpitations or other concerning symptoms accompanying them, it's time to talk to your doctor. They can help determine if the palpitations are benign or a sign of a heart condition. They might ask you questions about your medical history, lifestyle, and any medications you're taking. They might also recommend some tests, like an electrocardiogram, to check the electrical activity of your heart. Remember, while some palpitations are perfectly normal, it's always better to avoid caution and get them checked out, especially if they're new, frequent, or accompanied by other symptoms. It's about listening to your body and taking those little fluttering signals seriously. 5. Dizziness or lightheadedness. This is a sign of reduced flow. Dizziness and lightheadedness can manifest in several ways. You might feel unsteady, like you're about to lose your balance, or the room spinning, which is vertigo. Lightheadedness can feel like you're floating or disconnected from your surroundings. It's important to distinguish these sensations from feeling dizzy after standing up too quickly. We're talking about more pronounced and persistent episodes. Imagine feeling lightheaded or dizzy even when sitting or lying down, or experiencing these sensations frequently throughout the day. This can be a sign of reduced blood flow to the brain, which various factors, including heart problems, can cause. Your heart is responsible for pumping blood throughout your body, and if it's not functioning efficiently, your brain may not receive enough oxygen-rich blood, leading to dizziness or lightheadedness. Pay attention to when these episodes occur. Do certain activities trigger them? Do they happen when you change position, like sitting to standing? Are they accompanied by other symptoms such as chest pain, shortness of breath, or palpitations? If you experience frequent or persistent dizziness or lightheadedness, especially if other concerning symptoms accompany it, it's essential to consult your doctor. They can help determine the cause and rule out any underlying heart issues. Don't dismiss these sensations as being a bit off or getting older. They could be an important clue about your heart health. 6. Sweating. This is more than just getting warm. Sweating is normal, especially when we're active or it's hot outside. However, excessive sweating, mainly when it occurs unexpectedly and for no apparent reason, can sometimes indicate a heart problem. We're not talking about sweating during a workout or on a hot day. We're talking about breaking out in a cold, clammy sweat even when sitting still or in a calm environment. Imagine suddenly feeling clammy and sweaty, as if you've just run a marathon, even though you haven't been physically active. This type of sweating can be particularly concerning if other symptoms such as chest pain, shortness of breath, or nausea accompany it. It can signify that your body is working harder than it should, potentially due to a heart issue. Think of it as your body's alarm system going off. Pay attention to the circumstances surrounding the sweating. Is it profuse? Is it cold and clammy? Does it happen at rest or during activity? Do other symptoms accompany it? If you experience sudden, unexplained, and excessive sweating, especially if other concerning symptoms accompany it, don't hesitate to seek medical attention. It's always better to be safe than sorry about your heart health. Don't dismiss it as just a hot flash or just being nervous. It could be a signal that something more serious is going on. 7. Nausea or vomiting. This is beyond just a stomach bug. Nausea and vomiting are commonly associated with stomach issues, food poisoning, or viral infections. However, they can also be a symptom of a heart problem, particularly during a heart attack. This is more common in women than in men, so women must be aware of this potential connection. Think of it as your body reacting to the stress of a heart event. Imagine feeling suddenly nauseous, like you're going to throw up, even though you haven't eaten anything unusual. Or perhaps you do vomit. This can be particularly concerning if it occurs along with other symptoms like chest pain, shortness of breath, or sweating. It's easy to dismiss nausea and vomiting as just a stomach bug or something I ate. Still, if these symptoms are persistent, severe, or accompanied by other signs of heart trouble, it's crucial to consider the possibility of a cardiac connection. Don't automatically assume it's just a gastrointestinal issue. If you're experiencing nausea or vomiting along with other concerning symptoms, it's always best to consult your doctor to rule out any underlying heart problems. They can help determine the cause and ensure you receive the appropriate care. 8. Pain in other areas. When we think of heart problems, we often picture pain in the chest. While chest pain is a common symptom, it's essential to realize that heart-related pain can also manifest in other parts of the body. This is often referred to as referred pain, meaning the pain is felt in a location different from where the problem originates. Imagine the pain radiating or spreading from your chest to these other areas. The arms are a common area for referred pain, especially the left arm, though it can affect the right or both. It might feel like a dull ache, a tingling, or a sharp shooting pain. The shoulders are another potential site. Pain in one or both shoulders can be a sign, sometimes mimicking a muscle strain or pinched nerve. The back, especially between the shoulder blades, can also experience heart-related pain, which might feel like tightness, pressure, or a burning sensation. The neck, particularly the left side, can also be affected with pain that feels like stiffness or soreness. And finally, even the jaw can be involved. Jaw pain, especially in the lower jaw or teeth, can be a surprising symptom of a heart issue, sometimes feeling like a toothache or a dull ache. It's vital to remember that pain in these areas, especially when it occurs with chest discomfort or other symptoms like shortness of breath or sweating, could be a sign of a heart problem. Don't dismiss it as just a muscle ache or a pulled nerve. Talk to your doctor if you experience pain in any of these areas, particularly if it's new, persistent, or with other concerning symptoms. They can determine the cause and rule out any heart issues. Don't hesitate to seek medical attention even if unsure. It's always better to be safe than sorry about your heart. Number 9. Swelling in the legs, ankles, or feet, edema. This is a sign of fluid buildup. Swelling in the legs, ankles, or feet, medically known as edema, can signify fluid buildup in the body. While it can have various causes, including prolonged sitting or standing, it can also be a sign of heart failure. Think of it this way: Your heart pumps blood throughout your body. If it's not pumping efficiently, blood can back up, accumulating fluid in the lower extremities. Imagine your shoes or socks suddenly feeling tight or noticing that your legs, ankles, or feet are visibly swollen, even after a relatively short time. The swelling might be more noticeable at the end of the day or after prolonged sitting or standing. If you press on the swollen area, you might notice a temporary indentation. It's essential to differentiate this from minor swelling that might occur after a long walk or a particularly hot day. We're talking about persistent swelling that doesn't go away with rest, elevation, or swelling accompanied by other concerning symptoms, such as shortness of breath or fatigue. If you experience persistent or unexplained swelling in your legs, ankles, or feet, particularly if other symptoms accompany it, it's crucial to consult your doctor. They can help determine the cause and rule out any underlying heart issues. Don't dismiss it as water retention or tired legs. It could be a valuable clue about your heart health. Number 10. Persistent coughing or wheezing, more than just a cold. Coughing and wheezing are common symptoms of respiratory illnesses like colds or allergies. However, a persistent cough or wheezing can sometimes indicate a heart problem, especially with other symptoms. Think of it this way: a weakened heart can sometimes lead to fluid buildup in the lungs, which can trigger coughing or wheezing. Imagine a cough that won't go away, even after trying over-the-counter cough remedies. Or perhaps you experience wheezing, a high-pitched whistling sound when you breathe, even though you don't have asthma or other respiratory conditions. This cough might be dry and hacking or produce white or pink-tinged mucus. It's especially concerning if the coughing or wheezing is accompanied by shortness of breath, fatigue, or swelling in the legs. Attributing a persistent cough to a lingering cold or allergies is easy. Still, if it's persistent, worsening, or accompanied by other symptoms, it's essential to consider the possibility of a cardiac connection. Don't dismiss it as just a cough or just allergies. If you're experiencing a persistent cough or wheezing, particularly if other concerning symptoms accompany it, it's essential to consult your doctor. They can help determine the cause and rule out any underlying heart issues. They can also differentiate between a cough caused by a respiratory problem and one related to your heart. 11. Anxiety. This is when worry mimics heart trouble. Anxiety is a common human experience, and feelings of worry or nervousness are a normal stress response. However, sudden or persistent feelings of anxiety, especially when accompanied by physical symptoms, can sometimes mimic the signs of a heart attack or other heart problems. Think of it as your body's stress response system going into overdrive. Imagine experiencing a sudden surge of fear or panic, along with physical symptoms like a racing heart, shortness of breath, sweating, trembling, or a feeling of tightness in the chest. These physical manifestations of anxiety can be very similar to the symptoms of a heart attack, which can be understandably frightening. It's important to differentiate between anxiety and a heart event. While anxiety can cause chest pain and other physical symptoms, it usually doesn't involve the same kind of crushing or squeezing sensation that's typical of angina, which is chest pain due to reduced blood flow to the heart. Also, anxiety symptoms tend to come and go more quickly, while heart attack symptoms often persist. However, it can be difficult to tell the difference in the moment, so it's always best to err on caution. If you experience sudden or severe anxiety, especially if it's accompanied by chest pain, shortness of breath, or other concerning symptoms, it's crucial to seek medical attention immediately. Even if it turns out to be just anxiety, it's essential to address the underlying cause of your anxiety and develop healthy coping mechanisms. Furthermore, persistent anxiety can itself contribute to heart problems over time, so managing it effectively is vital for your overall health. 12. Sleep disturbances. This means restless nights and a tired heart. Sleep disturbances are a common problem affecting millions of people. While occasional trouble sleeping is not a cause for concern, persistent sleep problems, especially when accompanied by other symptoms, can sometimes be related to heart issues. Think of it as your body struggling to rest due to underlying problems. There are a few ways sleep disturbances can be connected to heart health. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, can strain the heart and increase the risk of heart disease. Symptoms include loud snoring, gasping for air during sleep, and daytime fatigue. Insomnia, characterized by difficulty falling asleep or staying asleep, can also be a sign of heart problems, or it can worsen existing heart conditions. It's a complex relationship, as poor sleep can affect heart health, and heart problems can disrupt sleep. Waking up suddenly in the night feeling short of breath, often needing to sit up to catch your breath, can be a sign of heart failure. This is usually referred to as paroxysmal nocturnal dyspnea. Finally, restless leg syndrome, while not directly a heart problem, which causes an irresistible urge to move the legs, can disrupt sleep and contribute to overall fatigue, indirectly impacting heart health. It's important to note that sleep disturbances are often multifactorial, meaning they can have various causes, not just heart problems. However, if you experience persistent sleep problems, especially those accompanied by other symptoms like chest pain, shortness of breath, or fatigue, it's essential to discuss them with your doctor. They can help determine the cause of your sleep problems and rule out any underlying heart issues. They can also recommend strategies for improving your sleep hygiene and ensuring you get the rest your body needs. Remember, quality sleep is essential for overall health, including heart health. Protecting your heart is one of the most important things you can do for your overall health and well-being. It's about weaving healthy habits into the fabric of your daily life, not just making occasional changes. Think of it as nurturing your heart, giving it the care and attention it deserves. 1. Diet. A great place to start is with your diet. Imagine your plate as a canvas and you're painting it with vibrant colors, loads of fruits and vegetables in every shade imaginable. These are packed with nutrients that your heart loves. Swap out the white bread and pasta for whole grains like brown rice and quinoa. These provide sustained energy and are suitable for your heart. Protein is essential, but choose lean options like chicken breast without the skin. Fish, especially the oily ones like salmon, which are rich in omega-3s and plant-based sources like beans and lentils. Don't fear healthy fats, they're crucial for heart health. Think avocados, nuts, seeds, and olive oil. But be mindful of the less healthy fats in processed and fried foods and limit added sugars and salt. 2. Exercise. Movement is medicine for the heart. Aim for at least 150 minutes of moderate intensity exercise each week. That might sound like a lot, but you can break it down into smaller chunks, like 30 minutes most days of the week. Find activities you genuinely enjoy, whether a brisk walk in the park, cycling, swimming, dancing, or gardening. The key is to get your heart pumping. If you're starting, take it slow, and gradually increase the intensity. 3. Quit smoking. One of the most impactful things you can do for your heart is quit smoking. It's the single best thing you can do for your cardiovascular health. Talk to your doctor, they can help you find practical resources and strategies. Even avoiding secondhand smoke is essential. 4. Weight management. Maintaining a healthy weight is also crucial. Even losing a small amount of weight can significantly reduce your risk of heart disease. Your doctor can help you determine your healthy weight and create a plan to achieve and maintain it. 5. Stress management. Stress can take a toll on your heart, so finding healthy ways to manage it is essential. This could involve exercise, relaxation techniques like deep breathing or meditation, spending time with loved ones, or pursuing hobbies that bring you joy. Number 6. Sleep. Prioritizing sleep is another key factor. Aim for 7 to 9 hours of quality sleep each night. Lack of sleep can disrupt your body's systems and increase your risk of heart problems. Establish a regular sleep schedule, going to bed and waking up around the same time each day. Number 7. Regular checkups. Knowing your numbers is empowering. Regular checkups with your doctor are vital. They'll check your blood pressure, cholesterol, and blood sugar levels, all critical indicators of heart health. Discuss your risk factors with your doctor, including any family history of heart disease. 8. Alcohol consumption. Moderation is key regarding alcohol. If you choose to drink, do so in moderation. No more than 1 drink per day for women, and no more than 2 for men. 9. Proactive approach. And finally, be proactive. Don't wait for symptoms to appear. Make heart-healthy choices a part of your everyday life. It's an investment in your future, allowing you to live a longer, healthier, and more fulfilling life. These heart signs can be subtle, and it's essential to pay attention to our body and seek medical attention if we experience any unusual symptoms. By being aware of these signs, we can take control of our heart health and reduce the risk of complications. It's crucial to be mindful of our lifestyle choices and their impact on our heart health, making informed decisions that promote a healthy heart. Every sign warns that something may be wrong. Taking these warnings seriously is essential. Did you find this video helpful? If yes, give us a like and subscribe if you have not done so. Now we want to hear from you. Have you experienced any of these symptoms? Share your stories and concerns in the comments below, and don't forget to check out our other video on maintaining a healthy lifestyle for more valuable tips on keeping your heart strong. Your heart will thank you for it.